What drives peak performance? Is it talent, training, or something deeper? From the boardroom to the playing field, success for women often comes down to both mental fitness and the unique physical realities we face. Today, we're going to uncover what high-performing professionals can learn from elite athletes, what young athletes and their parents can take from the pros, how ADHD affects performance on and off the field, and why self-awareness, self-care, and paying attention to women's specific physical needs might be the ultimate game changers. Hi, welcome to Beyond the Paper Gown. I'm your host, Dr. Mitzi Krockover. When I first met today's guest, I was struck not only by her impressive credentials, but by the unique field she has helped define, performance psychiatry. Dr. Brook Choulet built her practice around a title she made her own and trademarked, the Performance Psychiatrist. As founder of Choulet Performance Psychiatry, she helps executives, athletes, and high achievers unlock their peak mental health and performance. She serves as sports psychiatrist for the ASU Sun Devil Athletics, is a lead mental health clinician for USA Team Handball, and has worked with the Phoenix Suns and Mercury. She's also president of the American Board of Sports and Performance Psychiatry, a Forbes contributor, and a member of the Forbes Health Advisory Board. In short, Dr. Choulet has a front row seat to what it takes to thrive at the highest levels, whether that's on the court or in the C-suite. And what makes this conversation so important for women is that we'll talk not only about strategies for mental resilience, but also about the physical factors, from hormones to nutrition to body image, that uniquely affect women's performance. I can't wait for you to hear this conversation. But before we begin, just a quick reminder, this podcast is for informational purposes only and should not be considered medical advice. Please consult your own healthcare provider for guidance specific to your situation. Dr. Brook Choulet, welcome to Beyond the Paper Gown. Dr. Brook Choulet, thank you so much for being with us today.
Thank you. I'm excited to be here.
Oh, and we are happy to have you. When you and I met and I heard about what you were doing, I was really intrigued. Obviously, by your CV and resume, you're a high-achieving executive as well, and you're working with all sorts of high-achieving folks. But how did you get into performance psychiatry, and what does that mean?
Mhm. So my mom and grandfather are psychiatrists, so I'm a third generation psychiatrist. My grandpa primarily was in academics. My mom's been in solo private practice, so they both thought I was crazy when I set out to start a group private practice. So I started my practice during residency training and hired board certified psychiatrists while I was in training to start seeing patients so I could have a job to transition to when I was done. And then I really found myself kind of falling into the sports world and business world a bit in terms of the patients that were finding me. It was a concierge psychiatry clinic, but what I kept finding was that the people that wanted that service were either executives, they were athletes, or their children. So I ended up federally trademarking the term performance psychiatry to really define not only taking someone from where they're at mentally, but then optimizing their mental health without the need to be treating a clinical diagnosis, so to speak. So talking to people who are experiencing burnout or just high pressure situations and how to maximize their performance by optimizing their cognitive health.
Okay, so when I think of psychiatry versus psychology, I think more medical, a more medical focus versus a more therapeutic focus. And so, how does that translate for what you're doing?
I'd say most of my patients are seeing me for therapy as well. And I would say maybe 60% are on medication. So there are a good subset of people I see that are just engaging in psychotherapy with me or kind of more performance-based cognitive strategies. So I'm hoping that that's a myth that we're busting, that if you see a psychiatrist, you won't just be prescribed medication.
And when you do prescribe medication, is it for an underlying psychiatric issue or is it for specifically for performance?
Typically, it's for an underlying psychiatric issue. So, if there's clinical anxiety that's stifling someone's performance at home or at work, if there's clinical depression, ADHD is a big one that can stifle performance by decreasing focus and increase distractibility. So, we only prescribe if there's a clinical indication for that. But we will suggest supplements that can improve one's performance, like magnesium is a great one at night that people take to kind of decrease worry and improve sleep. So there are things like that that we'll suggest as well.
And you had a Psychology Today article where you interviewed NBA players like DeAndre Jordan and DeMar DeRozan about mental fitness. And you've worked with the Phoenix Mercury. What are some of the unique pressures that female professional athletes have?
I think the biggest one for female athletes in general across all sports and leagues is that difficulty with the pay inequity. So, and the treatment. I think for a while, up until I believe it was last season or 2 seasons ago, the women in the WNBA were flying on commercial flights on Southwest Airlines and other things like that, whereas the men always had private charter. So it's situations like that where it can really create a sense of kind of incongruency and inequity when women are just treated much differently than the male counterparts in the same sport in the same league.
And then how does that translate in terms of impacting on their performance?
It can create kind of some self-doubt about worth and some questions about identity, right? Because if you look at that female athlete that's getting paid 80,000 a year and then they see an NBA player getting paid 30,000 or 30 million a year,
Yeah.
now it's like, well, why am I different? Am I less than? Am I do I not matter as much? And so it can kind of have a toll on their self-identity and self-worth.
And from a physiological standpoint, how do like things like hormonal fluctuations throughout a woman's, not only cycle but life cycle impact on her performance?
Yeah, it can have a tremendous impact, especially for people that experience like premenstrual dysphoric disorder, or, women that are experiencing mood fluctuations ahead of their cycle. It can really kind of play a negative role in terms of their own mental health in that time period, which can then impact their performance. So if they're feeling more low energy, if they're having trouble concentrating, if their appetite's lower and they're not able to fuel as much before games, all of that can have a downstream effect on their performance.
And so, how do you counsel them in terms of managing all of that?
I think the first step is just self-awareness. Are they even aware that they might be acting differently during that time? Maybe they're getting some negative feedback and they're taking it, personally or critically. So just helping them understand and develop that self-awareness first. Hey, this is a recurring issue. I'm having multiple people in my life, both at work and at home, kind of point these things out to me, and then helping them create kind of what I like to call a pregame routine that can be consistent, whether they're playing at home or on the road. So things like that can be helpful to try to regulate their emotions. So things like mindfulness, things like pregame visualization, mental imagery, and things like that. Those mental skills tools can be very helpful to try and improve performance.
And I would also assume that nutrition and changes in appetite through the cycle
Mhm.
and energy are also factors. And how do you approach that?
Absolutely. Most teams have a team nutritionist that will handle all of that. So luckily the psychiatrist can work within their scope, but it does play a role. And like I said too, when there is a change in appetite during that time before the cycle, maybe they're gaining weight and people are pointing that out to them. Maybe they're losing weight. Maybe depending on the birth control they're on, they're gaining more weight. So all these things have to be taken into consideration for female sports compared to men that really don't have to worry about any of the stuff that we as women have to worry about.
I think about my own daughters when they played sports in high school, and I'm sure a lot of folks that are listening may have daughters. What are some of the take-home messages in terms of just how as they're having their transitions, anything that they should be thinking about, or resources for them if they don't have the team nutritionist, for example?
Yeah, just really getting a good understanding of how you feel when you eat certain things. So sometimes people, if they're eating a lot of carbs or processed foods or sugars, they'll feel more low energy or they'll feel that inflammation more after playing or after a hard training session. And so maybe considering a non-inflammatory diet and focusing on eating fish and things like that that don't cause as much inflammation as red meat. So there are things that people can kind of learn by listening to their own body. It all just goes back to starting with self-awareness. So really having that understanding of how things impact you, whether it's food or certain people around you or the environment that you're in.
Exactly. That makes a lot of sense. And, just kind of continuing on a conversation with respect to young women, how do eating disorders and body image issues impact with performance? And what are some of the things that you do to help the folks that you counsel be aware of it and deal with it?
Mhm. A lot of women in aesthetic sports struggle with that even more than women playing non-aesthetic sports. So things like gymnastics, dance, those kind of aesthetic sports, there's a higher risk of developing anxiety and eating disorders, disordered eating patterns with those aesthetic sports compared to things like even like basketball or volleyball, things where it's not as focused on how you look, but more about how you play. Specifically with eating disorders, I don't treat a lot of that because it's so subspecialized that I will always refer out to someone who just sees eating disorders, especially if I can find someone that just sees eating disorders in athletes, which is harder to find, but it is out
Sure.
there. Because you do need such comprehensive services between the therapy, the medication management, the nutrition component, that it really does take like a comprehensive wraparound team to effectively treat those athletes. And I just feel like in the solo private practice setting, it's really I would be doing them a disservice if I were to try and take someone on just to help them. I will sometimes do the medication component, especially for things like binge eating disorder when we have great medications that are FDA approved for that. So I do find a lot of interest in binge eating disorder. But in terms of any of the restrictive anorexia, bulimia, those do happen a lot in athletics and they do happen a lot in females in aesthetic sports, but typically I'll refer out to an actual eating disorder center that has all those services.
And, in my experience, a lot of this is very insidious and
hmm
not obvious. So, what are some of the warning signs that not only the athletes themselves, but perhaps the parents might want to be aware of?
Yeah, I've had some recently where there's been an increased interest in girls with a normal BMI
Hmm.
wanting to be on GLP-1s. And it's like, tell me about that. What do you think is wrong? What do you think you need to fix? And so if I have a girl with a normal BMI telling me that they're overweight and that they don't fit into their clothes and that they need to be on a GLP-1, then I have a discussion with them about what it looks like to be a healthy, growing individual. So we do expect you to continue growing. We do expect you to need new clothes. It's healthy and normal. And I kind of reiterate those words several times rather than using words like more descriptive, like skinny or overweight. I'll always just say healthy or normal. But I have seen that a lot recently. Also, girls that come in really baggy clothes, even though they are thin or like have an athletic body type. That to me, I kind of question sometimes if they're in overly baggy clothes. How do they feel about their self-image or their body type, and kind of gently guide them down through some of those questions. But that is something I'm seeing more is normal BMI females that are asking to be on GLP-1s.
That's really interesting. And, obviously there's a cultural aspect to that. What is the impact of social media and some of the cultural influences? And how do you address that?
hmm It's really challenging because I'll often ask people, what's on your feed? What do you enjoy watching? And first just get a sense of what they're consuming. Because, for example, like for me, I'm 6 months pregnant right now, so I
Oh,
open my Instagram
congratulations.
feed. Thank you. And all I see on my Instagram feed's like pregnant, people or videos on babies or things like that. So it just shows you what an echo chamber, small section of the internet you're in, and what is your feed feeding you. So I'll often ask, like, when you open up Instagram, what's on your feed? What types of videos do you like to watch? And just get a sense of what emotional state then social media is causing for them. Do they feel hopeful or positive? Are they laughing, scrolling through their feed, watching funny videos? Or is it a little bit of envy, jealousy, feeling decreased self-worth, all of those types of things. So for me, I always start down that path of how do you feel when you open your social media feed?
Interesting. To shift a little bit, we're talking about athletes and physical activity. You've talked about this, and it's common knowledge that exercise boosts brain health. How
Mhm.
does that impact on performance?
Yeah, so with exercise, it's a really tough balance between getting good, adequate exercise that has positive effects and then not overtraining. Because a lot of athletes will think, well, if I just practice one more hour, if I just watch one more hour of film, I'm going to be a better player tomorrow. And so, really having a discussion about balance and how do you know when you're reaching your limits and having that discussion about overtraining, I really enjoy. Because for us too in the business world, we think, oh, if I just spend one more hour on email or one more hour on this project, I'll be better off tomorrow. But same thing for us, that's not always the case, and it could lead to burnout through emotional exhaustion. So I do really like to kind of ask people if they feel like they're doing too much, and if they do, is it because they feel like they have to, or are they sacrificing performance in order to continue to engage in physical activity? So that's another indicator too for potential body image issues too, is excessive
Right.
working out during the day. I've seen teenage girls that will work out for 2 hours in the morning and 2 hours after school. That's excessive. So just really first gauging what their current level of physical activity is like is important.
Going back, you had talked about medications, and it seems like ADHD is being increasingly recognized in women, and
Yes.
also that many, especially many high achieving women, are now receiving that diagnosis later in life.
Mhm.
So, how do you approach diagnosis and treatment for female athletes and their medication use
Mhm.
with respect to what they need to do on the court or field?
Yeah, that's a really tough one because a lot of times ADHD has become more and more prevalent on social media. So I'll get girls that come in and they're like, I think I have ADHD. And really, they've just started smoking a lot of marijuana recently or things like that. Another big thing, too, is if someone is presenting with concerns for ADHD in their 30s or 40s, but then you ask them about their school history and they've always done well in school, they've, functioned well academically and in their profession, and then all of a sudden, now in their 30s or 40s, these females are experiencing concerns for ADHD. A lot of times, that's actually anxiety because generalized anxiety can cause a lot of trouble with concentration. If you can remember, we've all had a time when we've been really anxious or distracted, and we definitely have not been able to focus well in those moments. So, in adults that come in with symptoms of ADHD, I'll always first kind of rule out anxiety because to me it's odd going through life very successfully and then all of a sudden having these concerns later. But on the flip side, there are women who have been struggling for a long, long time, like, oh, I've always struggled to get through school. I maybe got good grades, but I was trying 4 times harder than everyone else. So in those cases, they really have just gone their whole life without being treated. But then you throw in athletics and it introduces a whole other mix into the picture because stimulants are often prohibited substances. So in the WNBA, they have a certain protocol for what they call therapeutic use exemptions or getting the stimulants approved. NFL has a different protocol, MLB, MLS. So you really have to be well versed in every different type of sporting league to understand the implications of prescribing. Because, for example, the MLB is the most strict. You can't even send in that prescription to the pharmacy until the MLB is approved, that player is approved for stimulants. So it really could cause a disruption to the physician-patient relationship if someone were to send in a prescription and that player picks it up because they think they were prescribed it, and then they test positive and it wasn't approved by a league,
Hmm.
can pose a whole lot of different challenges.
And just from a physiological standpoint, any impact on these meds on performance specifically?
There is some anecdotal evidence and some clinical evidence that it can increase strength or increase performance, but again, we're not prescribing it for that. Or at least I'm not. Like you have to have a
Sure.
clinical indication for ADHD in order to receive a prescription. But also, you could argue that maybe some people notice an improvement in performance because they are able to focus on the ball better as it's coming towards them, or they are less distracted by the environment. So who's to say like what exactly it is that's improving their performance? It could just be having their ADHD symptoms adequately treated.
And you haven't seen it, though, negatively impact them?
Just in terms of sleep, so like in the NBA or WNBA, sometimes games will start at 8 o'clock, right? And so it's one of those weird things where for the typical person and the general population, you take their long acting in the morning and maybe the short acting around 2:30 or 3 p.m. But for these athletes who are maybe sleeping in, shoot around starts at 10 a.m. They take a midday nap before the game often,
Wow.
and then the game is at 8 p.m. Well, now you're kind of adjusting that immediate release to the game time in the afternoon. So that is, if you want to call that a negative impact, decreased appetite or decreased kind of or difficulty with falling asleep can be challenges.
Um, let's shift a little bit and talk about executives who you work with,
Mhm.
and high achieving professional women. You have, I think, said, and again, when I look at this, patterns of anxiety, perfectionism, and imposter syndrome, those are just my
Mhm.
friends
Yeah, yeah.
and me. But how do you distinguish between what seems like, kind of normal, high achiever stress and
Mhm.
the clinical conditions that warrant other treatment?
I always start by asking, is it causing disruption to your day-to-day functioning? So for me, that's the biggest thing. I mean, some people say their anxiety really drives them. So if it's something that's kind of an accelerant to you and it makes you perform better, then by all means, like have that. Because if we look at the bell curve of peak performance, you have to achieve a certain amount of stress, or if arousal or stress is at the bottom, in order to achieve optimal performance. So, too little stress, like when we go to the grocery store, there's no stress. So it's like we could go there and we're not in flow state, we're not performing at our peak, we're just going to the grocery store. Whereas if you asked me to walk out on an MLS field tomorrow and play in an MLS game, I'd be on the opposite end. It'd be like too stressful, too challenging, and my performance would probably plummet. So you have to find that optimal level of stress slash arousal to perform at what scientifically is called peak performance or flow state. That is really the science behind it, is kind of not letting your amygdala override with all the emotions, and then really tapping into that prefrontal cortex to be able to execute effectively.
Are there some things that you would suggest people try before they consult a psychiatrist or go to medication?
I think, again, going back to self-awareness, asking yourself, what is it in your day that's causing you dysfunction or disruption? For a lot of executives that I'll start working with, they feel like their schedule is running them and that they have no control and they have no time to do anything. And it's just false. That's a choice that people make. My schedule is so regimented. I tell all of my patients to have a highly regimented schedule where literally every hour of the day during business hours is allocated to something. So, like Thursdays from 8 to 12 are the only times I'll take external meetings. And that's just it. That I could choose, right, to have, sure, yeah, on this Monday or this Wednesday or whatever, but I'm doing a disservice to myself to not kind of bucket my days in a way that's set up for the most productive day possible. And when I've interviewed for media, high level executives or people really like functioning at peak performance every day, they all have theme days. So Monday, Tuesday internal, Wednesday, Thursday external meetings, or whatever it is for them. So that's kind of step one that I'll always take with an executive is asking what does your week look like? And do you feel like you have control over it? If you don't, let's actually plan out your weeks and you can't deviate from this.
That's a great idea. I just jotted that one down.
Yeah.
And how do you help high achieving professional women develop what you call mental fitness in terms of mind management?
hmm I think it's different for everyone. So some people really enjoy that early morning workout to get their day going and cold plunge and doing all these hard things that build mental toughness. Others really enjoy like the afternoon workout with the sauna after. So really anything like kind of customize your own wellness journey, whatever it is for you that you enjoy and that fills up your cup when everything else in your day is depleting your cup is really important. So I always talk to people about even scheduling self-care time. So on my Thursdays after 2 p.m. when I'm done with meetings from 2 to 5, it's just what I want to schedule. Is it a haircut? Is it a late lunch with friends? Is it going to get my nails done, doing all the things for me is really important to sustained high performance.
And because women end up being the caretakers, how
Mhm.
does that factor in to what you suggest and what you're seeing in terms of the folks that you counsel?
Well, then we have to talk about boundary setting. Why is this all falling on you? Talking about communication, talking about outsourcing things so that they're able to take more time for them. So to me, that's not really an excuse unless there's some sort of a financial means that's prohibiting them from doing that. We will always talk about let's just find ways for you to get this time back. And oftentimes it starts with setting better boundaries for other people because like I said, people will, oh, I can only meet at Thursday at 3 p.m. It's like, well, if you're accommodating that, then you're giving up the time that's meant for you. So you have to just say no. Well, just let me know when's the next Thursday over the next several months that you can meet in the morning. So I think that is one thing I really try and discuss early on is that you are the master of your own ship. You're the captain of your own ship, and you can set boundaries to effectively choose how you spend your time.
That's so important because it's so easy to forget that or not feel like that.
Yeah.
Going back a little bit to athletics, but I think it also pertains to so much more. We've seen athletes like Simone Biles and Naomi Osaka make public statements and public decisions about
Mhm.
how they were going to manage their mental health. So, what would you say to parents as to how to encourage their own daughters to normalize mental health and maybe for even those high achieving executives that, again, I think many women just don't feel like they can prioritize themselves, kind of going back to
Mhm.
that previous question.
Yeah, especially in youth sports, it's so important to set up a home environment that's supportive. Because what happens if every time your daughter gets in the car from youth soccer, you're like, oh man, I knew you knew how to do this and you should have done this differently. And like, why didn't you get more playing time? Whatever it is, are you creating an environment where then your daughter feels comfortable to talk to you about things that are vulnerable? So, what I encourage parents to do is every time after a game or after practice when your child gets in the car, just start with, hey, what are three things you thought went well today? I don't care if it's a win or a loss. That question can always stay the same, and it promotes an environment where things are positive and supportive, giving them space then to feel comfortable to disclose when things are getting tough.
You saw me kind of cringe because I remember I was that mom, though I did try to change. And I
Yeah.
think that's also good for us as women to say rather than to beat ourselves up, after it maybe feeling like you screwed up a presentation
Yeah,
or a meeting, to say what went well. So
right.
I think that's terrific. And what's your most important message for women who are excelling but struggling? And when should they, again, specifically decide to seek out
Mhm.
professional help?
Yeah, I think to me the biggest thing is boundary setting because that has to do with home life, with personal life, like with friends, with work, everything. And so as soon as you can effectively set boundaries for yourself and for other people, you will feel more in control of your days. So that to me is absolutely number one. But I think a lot of women just need to figure out where they're scheduling in time in their days or in their weeks to do things that bring them joy, whether it is like scheduling that nail appointment or a lunch with friends or killing two birds with one stone and having a friend go with them to their nail appointment. Anything like that, it just can make such a big difference in leaving your day feeling energized because burnout happens when people are not managing stress effectively and it leads to physical, mental, and emotional exhaustion. So we need to be more self-aware, again, that word self-awareness of when we're starting to slip into that pattern so then we can kind of reroute the ship to something different and change things up.
Makes a lot of sense. And so as we wind down, is there anything I didn't ask you that you wanted to make sure our listeners understood or know about?
One big tool that we talk about in my office is time blocking. So I see a lot of executives having like these mile-long running to-do lists. And I hate that because you just always feel behind. It psychologically sets you up to just feel like you're constantly failing. So what I encourage people to do is actually time block just like they would a meeting or an appointment in their calendar to just say like, I don't know, tomorrow 8 to 9 a.m. pay bills, call school, like call doctor's appointment, and actually block that time allocated to those activities. Because now you could take that off this to-do list. You can feel like you accomplished something or multiple things in a day and actually set yourself up for success.
No, that's great advice. I started doing that, and it makes all the difference in the world because
Mhm.
otherwise you're going to fill up your calendar and then there's no
Yeah,
time to do that, or you're too
right,
tired to do it.
right.
Well, Dr. Brook Choulet, thank you so much for being with us today. This was great information, and I know everybody will really benefit from hearing that.
Thank you so much for having me. I really enjoyed this discussion.
What a powerful conversation with Dr. Brook Choulet, the performance psychiatrist and founder and CEO of Choulet Performance Psychiatry. We explored how high-performing professionals can learn from elite athletes, the lessons parents and young athletes can carry forward, the impact of ADHD, and the vital role of self-awareness and self-care in sustaining performance. And importantly, we talked about the ways women's unique physical considerations, hormonal cycles, nutrition, body image pressures, intersect with mental fitness. It's a reminder that peak performance isn't just about pushing harder, but about understanding and supporting the entire or whole self. And if there's one takeaway, it's this: mental fitness and physical awareness go hand in hand. For women especially, recognizing those connections can be the key to thriving in sports, in leadership, and in everyday life. So I'll leave you with this question. What's one way you can build more self-awareness this week? Whether it's noticing how your body feels at different times of the month, checking in on your stress levels, or carving out time for rest that could help you perform at your best. Thank you again to Dr. Choulet for joining us, and thank you for listening. If you enjoyed today's episode, please subscribe, share it with a friend, and leave us a review. It helps us reach more listeners who care about women's health and well-being. And do visit us at beyondthepapergown.com to find more episodes, articles, and information about events and more. And while you're there, subscribe to our newsletter so you don't miss out on our latest announcements and news. Until next time, take good care. Our episode was produced by Patrick Shambayati and myself, and our associate producer is Kyla McMillian.